Hello, I am Dr. Anita Krishnan, consultant ENT surgeon with over 30 years of experience and specializing in allergy and allergen immunotherapy at Bangalore ENT Care Centre, Koramangala. One of the most common causes of indoor allergy is house dust mite. I would like to explain what is house dust mite. Everybody thinks it is a dust particle. Patients do tell me I have to drive through a construction site when I go for work, doctor. That is what is causing my problem. Then I ask them, do you sneeze outdoors or do you sneeze indoors? And they always say, the sneezing is indoors, doctor, as soon as I wake up. So obviously the culprit is indoors, not in the outdoor construction dust. And the culprit is house dust mite. House dust mite are microscopic organisms which are found in dust particles, and they inhabit, they're live organisms, and they live on the mattresses, cushions, upholstery, curtains, wherever there is contact with human skin. They live in humid and moist environments. Warmth of our body while we are sleeping allows the house dust mites to thrive in the mattress. They feed on our shed epithelium or our shed skin. The interesting fact is that the mite itself is not what we are allergic to. It is their droppings and fragments of their exoskeleton when they die. This will be floating in the air, and they're very dense antigens. They will be on the floor. There are patients who tell that, when I sweep, I sneeze. When I dust the house, I sneeze. So these particles float up in the air when you're sweeping or when you put on the fan. In fact, an air-conditioned room will be better than using a ceiling fan in people who have allergic rhinitis and sensitization to house dust mite. Now, these particles in sensitized individuals irritate their nasal lining and causes sneezing, itching, runny nose, blocked nose, everything we discussed earlier. Many people notice that the symptoms are worse in the morning as soon as they wake up. This is because through the night they are in contact with the house dust mite droppings in the mattress. Now, these things can be avoided by simple environmental control measures like vacuum your mattress, wash your bed sheets in really high temperature. I always tell my patients, put it in the highest temperature in your washing machine. This will help to reduce the load of the dust mite. There is no way we can completely avoid them. We have to learn to live in synchrony with them, or we have to learn to make our immune system less irritable and more tolerant towards the dust mite. I often tell my patients, burp your house, just like how you burp the child. Burp your house. This is a term which is actually gaining a lot of, importance now in social media. Burping the house means open the windows for some time, let the sunlight come in, clean the house, only wet mop, don't dry dust, because it will again antigens to your level and then you breathe it in. These are environmental control things that you can do to reduce your house dust mite allergy symptoms. The long-term control comes with identifying that it is house dust mite which is causing the problem, and looking at probably allergen immunotherapy, which trains your immune system to become more tolerant towards dust mite, and over a period of time your symptoms come down. Thank you for watching.